Hello, friends. A very good morning to all of you out there, and a very, very warm welcome from the entire team of Mrcpi Theaters. Thank you so much for joining in. Is my voice audible and clear to all of you out there? Hello, hello. Morning, morning, everyone. Thank you so much for joining in, and a very warm welcome to all of you out there. Hi, Hanadi. Hi, Farah. So good to see you, my love. Thank you very much, Insaf. Miss you too. Thank you so much. Seems to take the same enthusiasm of Mrcpi written. Remember, you guys putting in questions. I'm so happy that we are starting this journey, and I'm super proud of you guys giving so much of an hard work and spectacular results in your written exam. Big hello, Farah. Big hello, Anam. I was waiting for you. I hope not on duty. Apologies. Yes, we are back, and I'm so happy that you guys are together. I know that connectivity, that family feeling, helping each other in the written exam, giving the references, and making this written as a family member, clearing this exam, and now together in Mrcpi Osce as well. And I'm super proud of you guys for all your efforts. Apologies for making it early morning because I had Mrcpi Part 2 written session at 2 p.m. GMT, and I couldn't delay that because it's a huge batch. You guys know that. So that's the last batch ever where I need to do the time adjustment. And from back-to-back mock exams, it was a little difficult. I had to cover more topics. So I thought I'll meet you early morning. Walaikum assalam wa rahmatullahi wa barakatuh, Leila Nazir. I am so glad. So many of you are already active in the regular course, active in the fast track, and have already registered for the mock exam. I am so humble and grateful for all this faith in RFA, faith on me. Can't tell you guys that how much pressure it is. People who had been in the mock exams as role players, as observers, as listeners, they do know that how much pressure it is on 2 days before exam for the candidates, and of course for the mentor as well, to come up with the results and to make them successful. I hope and I pray this first step which we are taking today, that would lead us to happiness, to bliss, to peace, to togetherness, and to all the success with flying colors. Ameen sum ameen. Thank you so much. So a very warm welcome from all of us, starting this journey with the same enthusiasm, with that feel inside that we will have ups and downs in preparation, but we'll stick to it. With this feel that we would have good days, we would have comparatively less productive days, but it's okay. We would stick to the target, making this focus today that we have to clear. And in November, we have to make our completion to this degree Mrcpi Osce. We are starting this step today. Thank you so much. Samina, is it Osce session or written? Sweetheart, this is Mrcpi Osce, November 2025. Anam, it's more like an exam? Absolutely. 90% of the stations. Can you imagine? First day Osce, total we have 7 stations, right? 6 were from the mock exam. Second day again, 7 out of 7 were from the mock exam. All the long cases, I gave 1, 2, 3, 4, 5 guesses. First day, my guess number 1 came, and second day, my guess number 3 came. I was so contented with the performance. I hope and I pray that we get the best of the results, and praying a lot. I every time update the mock exams. Why? Because it is that the newer tendency. I'll just tell you one example. I was doing this Osce batch did not do endometriosis, the recent RCPI guideline, because it was published later after the written exam of March 2025. I told them in the mock exam, I'm telling you guys that endometriosis long case is coming. They said, ma'am, how are you so sure? I said, I know because they have been working on endometriosis for the last 6 months, and it's just been published in the last 1.5 months as a new guideline of RCPI. It would be the first long case in gynae. Please do it. And I remember in Ireland sitting together, I made them do endometriosis points, that this would be the HOPI, talk about hematuria, please talk about the bleeding, all points, talk about the cyclical pain, talk about the dyspareunia, and we revised together. And the day endometriosis came, it was the first gynec case. They were like, how could you? I said, it's just because the experience, experience of mentorship, because the things which are under discussion, the things which are new, the things which are new updated, Definitely, yes, they are tested. This is how the vision should be. Everything which is under discussion, everything which is new, updated, that has to be tested, of course. So we need to be updated on this. Until November, we have got time. I'm sure that you guys, with hands in hands, the moderators are already on throttle. They are all set to give you the feedbacks, and I can see that you guys are super active in the course, and I'm so very proud of you guys on this preparation which you're starting in today. Thank you so much. Farah says, I'm not updated with theory for the past 7 months. So during OSCE, will you guide? Absolutely, Farah. This is what I was talking about. The regular schedule. Every single course, I make an update in the regular schedule. I make an update in the sessions. I make an update in the mock exams. Why? Because every 3 to 4 months, things are different. And this is how we survive. It is not that we know the things. The mentorship is a continuous evolution, I always say. It is always a continuous update. We learn from the changes, and of course, we have to update ourselves. Every single structured discussion, Farah, which you will do, you will read the updated guideline for the same. All right. So when you start doing that, you'll understand that this is what I need to be fresh in. And Farah, message me privately that, ma'am, these are my old notes. I can give you 3-4 points just to add on them and make it updated. Because see, 100% change never happens, but it's just like slight points which are updated. We just need to add on to notes. I don't want you to start the notes from A, B, C, because it's going to take lots of efforts. It is just an OSCE exam. I want that you make use of previous notes. It goes for everyone out there who have their older notes available to them. Write points on them and make it updated, because 3 or 4 points would be new. Right? So don't waste your older notes, which I have taught you in the written exam. We just need to update them and make them highlight those. For example, take a red pointer and add those points that these are the updated points. That's it. And you're all good to go. And when you will present your case, you will definitely highlight those points that as per 2025 updates and recommendations, these are the evidence-based steps which we take now. So everybody knows that this is a well-prepared candidate. OSCE, ladies and gentlemen, is all about presentation. OSCE is all about how you go ahead and head to toe, how do you present yourself? Your dress, your hair, your presentation, your communication, your posture, your gestures, your choice of words, everything matters. So we are going to work on all together ourselves that how we are going to take this OSCE with an experience and collaboration in Ireland. I would give you all the tips so that you guys don't miss out the points to clear this exam. Thank you very much once again for spectacular performances in Abu Dhabi and in Ireland. And I'm so very proud of you guys. All those who are asking for the mock exams, the advanced registrations are open. I'm always packed with them. Please make sure that you do your advanced registrations. The ones who have already taken the bundles, you are in the group. Whosoever has booked the mock exam should be in the study group. Please make sure so that your head count is done by team and they can do the arrangements. People had been doing it earlier. It's not the first time you are taking any exam. I just want that you guys have a perfect attire in your preparation from day one. Again, I would say that we are in hospitals, we have kids, we have husbands and wives, we have families, we have other responsibilities. But when you put yourself into a target, and the target is the upcoming exam, which has been announced on 31st of October and 1st of November, this date from today, you're going to put on your calendars, and whatsoever happens, ups and downs would be there, little deviating from the schedule would be there. It won't always be 100% productive day, but it's okay. This date you should not forget, and mark it today in your heart, in your mind, with silence, that I am going to clear this exam whatsoever. This is the date in which you have to produce yourself to the best of your capabilities and the best of the candidates. With this promise, I'm sure Insaf, sure my dear Insaf, please drop in a message to me. I'm going to add you there. Yasmin just joined in the waiting room. That's great. So, Samina, not related to today's discussion. Sure, Samina, I want you to drop in a WhatsApp after this because I will be taking the OSCE discussion. We are starting the OSCE batch. If some personal thing needs to be discussed or something which is not related to OSCE, please drop in a WhatsApp to me. All of you know my WhatsApp. This is the WhatsApp number. So you can drop in a WhatsApp and I'm happy to get connected. Please. Wa alaikum assalam wa rahmatullah, Yasmin. Insaf, I'm writing your name because I am packed up so that I don't miss you, and just drop in a WhatsApp after that. So I'm going to add you. Walaikum assalam, Yasmin. We just had a chit chat, little motivation. Please listen to the recording and we're going to start the discussion for now. So are you all knowing about the OSCE date now? Yes, it is 31st and 1st, which is very early this time. Generally, the exam is in the 10 days of November, but this time they have preponed it to the last part of the October and 1st of November. And we've got two centers. We don't have in United Arab Emirates this time. We have in Ireland and we have in Riyadh, Saudi Arabia. We have the opening dates that are going to be in 13th of August. Now, people are asking that how to apply for the OSCE. All of you, please, I'm getting the documents, same as that of testimonial. And I was telling everybody that you don't need any testimonial now. That was for the Mrcpi written. All right, Anam, Insaf, Hanadi, my dear, Yasmin, anyone who has cleared Mrcpi written is eligible to take Mrcpi OSCE, and you will get an email 13th of August, you can register. Here comes a very important question which every time students, they ask me, ma'am, shall we apply for the OSCE or shall we not apply for the OSCE if you're not appearing in exam, if we do not intend to take this exam? Especially this question will be asked, I know, especially by the September appearing Mrcpi written students. So my answer is always that please apply for exam so that you're in a queue, right? Applying for the exam gives that idea that, okay, how much is the backlog? Where do you stand? And where is your application? So many times you do apply, but you don't get the confirmation. But at least not getting a confirmation puts you under the waiting list. Do you guys get what I mean? Right? Not applying would not put you under the queue, and you're not going to be in that queue of waiting. So if you want to appear even in February 2025, just a little gap of December, January month is there. Please do send your applications. Again, a very important point regarding the applications is that everyone who is appearing in exam, may that be Riyadh, may that be Ireland, you are responsible for your traveling arrangements, logistics, and the visa. The college does not take the responsibility. I give to my students for the mock exams the invitations. That's very helpful. I do get emails by the visa concerned departments as well for the confirmation that this is an invitation for the mock exam. I can do that on my own, but the college does not take the responsibility. Unfortunately, in the last two exams, especially from the Asian countries, some of the India and the Pakistan students, they could not reach out because of some recent flight problems, some unfortunate stressful situations, and few of the students, they could not reach out because their Ireland visa got delayed because of some passport issues. College does not refund the fees as well. Now the rule is that if you have paid for the exam, it is paid. It is your arrangement. So my suggestion to you guys is that if you have to plan for the start of the exam, any venue which you're planning, please make sure that your travel arrangements and your plan, if you want to contact any travel agency, you want to contact any person who's going to support, or you want any invitation letter, please do the arrangements from now. Make sure that the visa is valid for how much time. Few of the students, they are messaging me for the Umrah visa, for Riyadh and traveling there. Whatever is the case, please start preparing today, because it is very unfortunate that you pay the fee for exam and then you're not able to appear in exam because of some sort of circumstances or the traveling issues. Okay, so make sure that you start preparing it from today. You make your arrangements and you get all the information. This was about the date when we are appearing, and this is about the venues. Now, I wanted to tell you guys that how the Osce exam is planned. Now, before we start the Osce discussion, we have got the major universities of the world. We have got a European board exam. We have got the biggest Mrcpi exam. So out of all the Osces, take my words, it's not that I am making you overconfident, but this is just telling you as per the experience that Mrcpi Osce is considered to be the easiest one till date. When I say till date, I do not expect it after 1 to 2 years, because the saturation would be more. Every single exam in the world gets difficult when the saturation of the members is more. You can see today, when I took MRCOG in 2018, and when I see today, I literally tell to my mentees, all the followers, I keep on telling them that things are not as simple as they used to be. It was very straightforward. When you had to appear, you were getting seats. Now you're not getting seats. You have the backlog. The exam difficulty standard definitely is more. The failing is definitely more. And the struggle and the challenge as compared to when we were candidates and students, it's definitely more. And this happens in every exam. So the earlier you complete your Mrcpi Osce, better it is. I will show you one video. Yesterday, RCPI released a video. It was testimonials of the convocation, and I'm so proud. I will share that video with you guys. I will post it on page. All the students who are at the convocation, and they released that video with the testimonials that we appeared in Mrcpi Osce. I don't know whether you've seen that or not. Did you guys see that video? That was an RCPI. All the students, I'm proud to say that, were RFA champions. I'll show that video to you guys. Yesterday, students, they sent it to me. All of them were RFA students. And I'm so very proud that this encouragement from MRCOG to Mrcpi, which I give, you guys have worked so hard and you have reached to that point. All of them on convocation were from RFA. And this was really a proud moment for me that I had mentored them through this journey. Osce Mrcpi is 2 sections. One is a long case, which we do not have in MRCOG in Epcot, and one is the circuit, which is similar to other exams as well. Now, when I talk about the long case, we do not have any other long case to compensate for the long case. I always say long case has to be passed separately. They say long case as a clinical exam. Please learn these terms, because often when you get the result, you're always sending me, ma'am, clinical exam is passing, clinical exam is failing. What does that mean? So when they say the clinical exam, they mean in exam or in the result, they are talking about the long case. And long case, everyone, is 25 minutes. Now, everyone has to do one long case, either obstetrics or gynecology. We have 25 minutes in which we are observed by 2 examiners, and we have to take a good history examination and then investigate, do the management plan, answer certain viva questions from the second examiner. From today, you guys have to understand the gist of the long case so that there is no confusion in exam. When I say long case, I want you to know about that there's an obstetric and there's a gynec long case, all right? We have obs and we have gynae, but what you're going to get is just fated that day. Cubicle number 1 is obs, gynae, obs, gynae, obs, gynae. So Farah goes to 1, she'll take obs. Anam goes to second, gynec. Insaf third, ops. Hanadi fourth, gynec. Did you guys understand? And you do not know when you're outside. They'll just mark you, please. 1, 2, 3, 4, 5, 6. Just start standing outside the cubicles. When you go inside, then you realize it's a gynec case or an ops case. And only that one case has to be presented. We don't have a compensatory second case to pass. So long case has to be a passing one because it's only one. Remember that long case and the circuit. There are two separate exams with the gap of like 2.5, 3 hours in between, but both have to be separately passed. A 90% score in long case does not compensate for 50% in the circuit. Or 90% in the circuit does not compensate for 50% in the long case. Do you guys get my point? Am I clear on this, Anila, Yasmin? Did you guys understand? Long case has to be passed separately and the circuit has to be passed separately, Soumya. So good to see you, my love. Separately, you have to pass these entities because there is no merge and there is no compensation for each other. Unfortunately, the students who fail Anam, they get the message long case or the clinical exam is not meeting up the standard. Or the Osce exam, which they mean about circuit, has not met up the standards. So you get separate results. And if both of them are pass, you get a passing result. Understood? Here, I have to tell you a very, very important trick. Sana, I'm coming to that, my love. I'll just explain that to you just now. I'm coming to a very, very important point, everybody. And that is, it is very heart-wrenching, but I have seen students with percentage of 75% and failing exam. And the passing percentage like 68%. How? Because they score very good in one of the section, but the other section goes failing. So students, they message me, ma'am, my percentage is way higher than the passing percentage. Then how do I fail? Do you all understand? Such good percentages, but the exam is failing. Why? Because one entity is not passing. On the other hand, if you do mediocre in long case and the circuit and you clear both of them with just a margin of 68%, you will pass the exam. This is very different to that of other OSCEs. You have to understand this. That's what I'm saying, that if you score 90% in the long case and you score 40% in the circuit, no matter your overall aggregate would be 75% and above, passing is 68%, but you will not pass the exam. No matter you score 68, that is margin on both, and overall score is 68%, and if the passing is 68%, you will pass the exam. Do you all get this point? So the aim is that two separate entities, it's not that we are very good in one and we are lacking the preparation for the other. Both entities should be passing because they're not going to compensate for each other. Are you guys with me on this? Did you guys understand, everybody? This point has to be understood today when we are starting the preparation, because tomorrow when you guys are putting too much of a stress on one element and the other element gets lacking in preparation, then we start feeling that something was missing in the preparation. So you need to understand that today. Am I clear? Did you guys understand the marking scheme, please? Did you guys understand that how the long case and the circuit, they might affect your final score? Anam, Sana, did you guys get it? Yes, Farah? Great. On the other hand, since 2019, we had two examiners before COVID, and one of the examiner is for the history and examination, and the second examiner is for investigation and the treatment. So please understand that both the examiner's key should be passing you. And it should not be like you're good in history and examination and you're not good in the taking the further case, right? I'll give you tips just in a bit and tell you that how we have to prepare the history. Now, the clinical case, 25 minutes. I give you all the repeated long cases in the regular and the fast track, and nothing would be outside that. Always the cases are similar. It's just a little up and down in the role plan. Make sure that after your long case, in this exam, we had the long case in the morning, and then there was a gap of 2 to 3 hours, and then we have the circuits. So when you talk about these circuits, there are 7 circuits which are back to back in the circle. We have an 8th station, which is, I call it as breathing station because it's a rest station. So you should know that how it works. It works like this. You have 10 minutes for each station. Please remember, it includes your reading time. You are not given any separate reading time like in Mrcog. In Mrcog Osce, we have a 2 minutes reading time and 10 minutes performing time. In Mrcpi Osce, the bell rings, you have to go into the cubicle. Inside, there's no outside station. Inside, you have the station and your 10 minutes start. So basically, when you're reading, that's part of your 10 minutes. Am I clear? Right? You do station number 1, you go to 2. You do station number 2, you go to 3, 4, 5, 6, 7, 8. Out of 8, only 1 is the rest station, right? So we have total 8 stations, and out of 8, 1 is rest station and 7 are practical stations. Out of those 7 practical stations where you have examiner, 6 are structured discussion. That means that you're discussing with an examiner, and 1 is a simulated patient task, which means that you are with the role player. So there's only 1 communication station, contrary to Mrcog 3, where we have 10 communication stations. Right? So there's only 1 communication station when it comes to Mrcpi. With regards to the circuit stations, remember that they have given a very clear description. And when I reach out to the fast track, I tell you guys that they do these 7 topics and 1 cubicle is done. Right? Do this 1 and do these 10 topics and 1 cubicle is done. I give you separate sections of the cubicles. 100% 1 hands-on is there. 100% obstetric emergency labor ward is there. 100% 1 surgery is there. So I pen down 10 surgeries, 1 cubicle done. I pen down 10 maternal medicine, 1 cubicle is done. I pen down 10 communication stations, 1 cubicle is done. This is my last 2 minutes, 2 months preparation technique for you guys. In the regular, I'll make your basis. I'll give you everything so the curriculum gets prepared. When we will be in the last 2 months, when we are sure that we are preparing an exam and you get the seats, then we start preparing topic-wise. That, okay, these 10 topics, 1 station done. These 10 topics, 1 station done. So that we prepare our 7 circuits. Sana says, can there be more than 1 SPT? For the last 7 years, the pattern is the same, and they've not changed the pattern. However, if any change in the pattern is there, college tends to announce that. For 7 years, the pattern has been similar, Sana, that there's only 1 simulated patient task, and they announce and they email this pattern prior to the exam to all the candidates who get the seat. You all get an email as well, my love. All right. So for 7 years, the pattern is not changed. Until date, the college has not changed the pattern. Okay. Right. Please tell me that, am I clear regarding the circuit distribution? Because if you know what you're appearing in exam, then only we will start preparation with confidence. I repeat once again, 1 long case, 25 minutes in the morning, and then there's a break of 3 to 4 hours, and then we have 7 stations, total 8, 1 rest station. So that means 8 into 10 minutes, you have around 80 minutes time for the circuit to be done. That's the whole exam. It is not at all exhaustive exam. Literally day before yesterday from Abu Dhabi, from Chennai, and from London. 14 stations back to back, 2 minutes, 10 minutes, 2 minutes, 10 minutes is around 3 hours exam. And that's a very, very exhaustive exam. Here, you get 3 hours break. You get to go to the cafeteria, you have prayers, you have toilet breaks. There's a break between 25 minutes and 80 minutes, 3 hours break. Exhaustion is never in Mrcpi Osce. So whatever you're doing, you're fresh always, generally. You never get exhausted. In MRCOG3, exhaustion overwhelms so much that the last 1 hour, things are in front of you and you feel dizzy. You feel blackouts. So that is the best part. Like you compare written, right? 100 single-based answers were never exhaustive. We are always fresh in those 3 hours because 100 SBAs are not that big a deal as compared to extended match questions. So the paper pattern is quite supportive. It's candidates friendly paper pattern. Do you guys agree? Right? Doing only 8 stations, and that too out of 7 stations, we have 1 rest station where we get breather as well. In MRCOG3, we don't have any rest station at all. And 25 minutes long case. And with the long case and the circuit, we've got 2 to 3 hours break. So it's quite a candidate-friendly exam in terms of stress level. It might be the anxiety of exam, but the exhaustion is not there. You're quite fresh because morning you're fresh, you're doing the long case, and then you get a break, and then you're ready for the circuit. So it's quite doable if you prepare well, right? Absolutely, Anam. That's the only way to live life, I always say, because if we keep on seeing the negativities, we can't go through the tough times. Yes, and the preparation undoubtedly is a stressful time. Yeah. Am I clear about the exam pattern? So I move to the next. Yes. I will give you around 150 total topics, which you will learn with me. That would be with the regular and the fast track. And I can give you my words, nothing would be outside this. I will make the recent summaries, and 2024, 2025 updates will be 100% coming up. I'll give you the points and I will teach you in the session that these are the points, remembering how you have to speak, how you have to present. And I'm so very strict when it comes to presentation. I give lines that this should be the opening sentence. My student in Ireland, I was telling them that, okay, how would you manage this case? I'll just give you one example. One of an Irish student, she was there in the Osce, and it was an obstetric cholestasis case we were doing. I asked her, Anna, how would you manage this case? And she was like, I would manage this case with this, 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 this. And she gave the right management. I was like, I'm not happy. She said, did I do something wrong? I said, no, the management is okay. But why? Why can't we make it more beautiful? Why can't we make it more impressive? If I would be at your place as a candidate, I would say, as per the history, examination, and investigation, my diagnosis is intrahepatic cholestasis. The aim of my management would be a healthy maternal and fetal outcome. The risk factors of my patient are these. So I will start with a multidisciplinary team. And I was like, why can't we start with an impressive line? I love good opening lines. I love good ending lines. And examiner is like, yes, this is the candidate I'm looking for, right? So you have to present yourself in a way that you sit into candidates should be sitting into the examiner's mind. Why? Because examiner is listening to somebody before you, and examiner is going to listen to somebody after you. I want very good, solid opening sentences, evidence-based words, and showing yourself as the most patient-safe doctor in the world. It's not only that you're going to pass, you all would score more than 80%. So cram my lines, learn them, but try to mold them the way you want to speak and present it confidently. That's the gist and the idea about Osce. Osce is different to written. It's how you carry yourself in exam, how you present something which is written in the form of lines in the guideline, how you impress the examiner with an evidence-based and a patient-safe attire of yours. Could I give you an idea that what do I expect in the Osce from you guys, right? Know the points and then learn it in a way that you can present it confidently, beautifully, touching the evidence-based recommendations and information. Yes, Sana says is not having 2025, 2024. Everything would be there. Don't worry, Sana. Every single update till 2025 would be on your portal, and we would do that in the sessions as well. So you don't have to worry about this. Every single recent guideline would be updated on your portal. That's part of your subscription. So you don't have to worry. Not only that it would be part of your subscription, we are going to discuss that as well, that what points we need to highlight to impress the examiner. I will make it very smooth sailing, but I just need effort from your side to speak them more, stand in front of the mirror, and try to present more and more. All right? Okay? Clear? So how to pass Mrcpi Osce? Mrcpi Osce, you need to understand the pattern first. You need to understand the skills that you need to know. You should be knowing that what content has to be prepared, how much time is needed for now. You should know that we have long cases, we have Osce circuits. For the regular batch, I don't merge them. I take circuit cases separately in sessions, long cases separately. I'm going to have 8 sessions, 4 for circuit and 4 for long cases, and that makes a very good basis. But when I come to fast track, I do 1 exam in 1 day. I will start from Abu Dhabi recent exam and go back. 2 days of Abu Dhabi, 1 day of Ireland, then we'll go back, go to the Oman exam February, then go back to the November 24. So I do complete 1 day, 1 exam with 7 circuit and 2 long cases of that day. Why? Because by that time, I feel that you guys are very, very strong in circuit and long cases, and I do not repeat any station from the regular in the fast track or from the fast track in the regular, and then final mock exam. So regular, fast track, and the mock exam gives you a very clear sailing, and none of these station, it would be out of this. So you can multiply that, Farah. 7 circuits every session in the fast track with 2 long cases. I mean, there's 1 exam, so I do 6 exams. I do last 6 exams in the fast track, right? So, and I don't repeat. For example, Farah, in last exam, endometriosis was there, and in the 6th from the last was also endometriosis, so I will not do 6 from the last. I will go back to the 7th paper. Do you understand what I do? So when I see the list, I see, okay, I have covered it. It's a repeat one. In the last 3 exams, 2 repeats were there. So I'll go back to the 7th or the 8th paper to cover that up. And I tell you in the session that this station I have covered up from the previous. Absolutely. Last 2 years. But 1 session is 1 complete exam. I do it that way. I mean, long case is also there. Circuit is also there. In regular course, I do circuit separate and I do long cases separate session because I have to build in, I expect more of the mistakes in the regular. From the basis will make you very strong in the regular and then from the fast track. So in regular course, almost 100 exam tested stations. The fast track also, it's going to be 6 complete exams. So that makes around 2 years of the last exams. Nothing comes out of that. When it comes to the circuit presentation, we have 6 examiner discussion and we have only 1 patient discussion. I expect you guys to speak medical terms when it comes to the structured discussion. The examiner is very, very happy when you know the evidence-based information. And when it comes to SPT, you should know that you have to be empathetic, you have to be sensitive, you should know the way to break the news, you should know that how we have to negotiate with the patient, everything, right? Farah, what type of recordings do you need? Audio? Yeah, so every single thing is in the Telegram group. It's going to be discussed there, right? Okay. Now, when we talk about the SPT, we are going to do 1 sample here. We will be doing all the discussion of exclusively all types of the empathy, not using jargons, using the simulated patient task language, breaking bad news. All these topics would be discussed, and we are going to do 1 negotiating station, which is a recent recall today as well as a sample. Then the long case, please understand, divide it into sections: a history, examination, differential diagnosis after history examination, doing investigation, making a diagnosis after investigation, and making a treatment plan. Out of this part is with the first examiner, and this part is with the second examiner. Every single part has to be passed. So my long case way is that make your history strong, make your examination strong, make your way of asking investigations the way I teach you strong. And every single case, I try to make it organized so that when you're strong in your history, you make a very good foundation. Nobody can fail you if you make a good history. A weak history leads to a weak treatment plan because you miss out things. Different examiners, Anam, are different, Farah. Few of them will say, can you please summarize the history? And few of them would not. Few would say, can you summarize your examination? Few would not. And few after history and examination would say, please summarize your case. So in all these cases, you should be able to utter a very good, solid summary. I give all the explanation, I give all the details. You would be able to do that after my long case session in a very, very confident manner. There's an art of doing a differential diagnosis. I see students, I will give you one example. The patient is obese, she's diabetic, she has got postmenopausal bleeding, right? I'll give you one example that how you, despite telling the differential diagnosis, you guys fail. You have to learn it today. She has got postmenopausal bleeding. She is having diabetes mellitus. She's got an obesity, maybe 35 BMI, and she has come with postmenopausal bleeding, right? And with all this, I have lots of differential in my head. And out of these differentials, if you first say cervical ectropion, I would be like, what is this? Right? So my way is that when you tell differentials, your topmost diagnosis will go up. This is a wrong DD. I'm not saying that cervical ectropion can't be the cause, but it would be somewhere 6th or 7th, bottom down in the list. I would be thinking about first, maybe, endometrial atrophic vaginitis can be there, right? I would be thinking about endometrial hyperplasia, atypia without atypia. I would be thinking about endometrial cancer after atrophy. Go with the most common differentials. Yes, I will come down to the local causes as well. I will come down to the polyp as well. I will come down to these, but not in the start. So there's a way and there's a beauty of telling differentials. While telling the differentials, you are telling examiner your approach towards the case. Very well done, Farah. Very well done. So if you put ectropion in the top, so many times in the long cases, students are like ectropion, local causes, any sort of a, polyp. If I am giving you a diabetic with high BMI and postmenopausal bleeding, so they're very typically going towards your differential should be your vision. What do you think is most likely should be first? So you get borderline in your differential diagnosis if you start numbering it like, for example, trauma can be a reason for postmenopausal bleeding as well. I agree. But trauma would be somewhere coming up in the end when I'm talking about high BMI diabetes. Do you guys understand what I'm trying to say? Are you guys with me on this? Yes? So this is what you guys need to learn in long case. It's not that you guys don't know, but I don't want that my students are haphazard. I don't want that they're just like putting in the points from here and there and putting in front of the examiner, like examiner has to gather up. I want a very structured presentation. I will teach you that, and then you guys are going to practice on that lines. Am I clear? Am I able to give you an idea that despite knowing that postmenopausal bleeding is the most common case, still there is a chance that we fail because we are not structured, because we are not giving a patient-safe approach, because we are not giving our exact idea that yes, we know as a clinician how to filter the diagnosis, right? Very well done. We give DD after history and examination, so that too can give an idea how to make a DD. Absolutely. Differential diagnosis, ladies and gentlemen, are always after history and examination. That's why we call them differential. Then, Farah, we ask the investigations, and I have my way of asking investigations. I will tell you that how to impress in asking investigations. When you tell investigations and you get the reports of investigation, then this DD changes into diagnosis. For example, Farah, I will ask the endometrial biopsy in the investigation, right? In this case. So I will get the idea endometrial hyperplasia with atypia, so my diagnosis would be there. Do you guys understand the sequence of the long case and how we have to beautify each section in our presentation? Claire, do we have to justify? Absolutely. If you don't justify, you don't get the score. You have to justify each investigation. And then you make an evidence-based treatment plan. If you have a good history, if you're solid in your examination, if you know how to justify the differential, if you know how to ask investigations, if you can justify your diagnosis according to the investigation given, you make a very solid treatment plan for obstetrics, healthy baby, healthy mother, and for gynecological case, a very clear outcome. Nobody can fail you. This is a technique you need to learn. Every single section of long case, I will teach you one by one in the sessions. The first long case session, I'm going to work on your histories, then I'm going to work on your examinations, then we'll work on DD, investigation and diagnosis, and of course, treatment plan will go side by side according to the evidence-based information, right? So this is my way to make it stronger. I definitely am going to put my 100%, but when I'm putting 100%, I need 200% from your side as well. I know that this is doable. The time needed from my side from today for you guys is going to be around 2 to 3 hours. We are going to get the list and all the list, they would be having your presentations and you would be getting all the written list there, Anna. So nobody is going to miss out, right? Okay. All the dates and the list would be there in a written format. So you don't have to worry about this. You'll know that these are your presentation sequence. All right. Okay. Now, from basic investigation like CBC, urine needs to be done for any gynec case or can be omitted. Farah, we can omit if it's not needed. But my way is that when any patient needs a laparoscopy or surgery for the gynec, so what we say in that situation is that we will do the anesthesia assessment would be done. And as per the protocol of anesthetist, the investigations would be done. Because Farah, at times ECG, chest x-ray, we don't do it from gynec side, but anesthesia department does it from the anesthesia side. So we are going to mention that. So my word is anesthesia protocol of the hospital would be followed and the investigations required by them for her anesthesia fitness would be done. So this is a safe statement to be spoken, right? As we are new to this, I have some confusion. We'll be sharing templates which we need to follow. Absolutely, Anam. Anam, were you there from the start? Anam Ehsan, were you there from the start? Because I told all the sequence of preparation, all the templates in the form of ebook are there. You're going to read them, learn them. Yeah, absolutely, Farah. Then they give that, yes, she's okay with that. Everything Anna Mesan is on your portal and you're going to learn from the ebook and every single topic, whatever it comes as an SPT or a structured discussion, it's there. All right. So all those who are already there in the session, you've got 3 options. You already are in the study group. You've got an active participant, which definitely I suggest, but then you've got listener as well if you want to observe. If students, they have mentioned me that they are listeners, they can do active participation in the fast track. So at least one of the course I should be listening to if any financial burden is there. Farah, drop in a message. I think your last course was shifted. Or you can book in. I think you can take bundle, right? You wanted to take bundle, correct, Farah? You wanted to take bundle, right? All 3 together. Yes, sure. Just message or to website team on this number. They'll give you the bundle. Or I think if you go to the open May and November group there, the bundle is posted as well. So the benefit of bundle is, guys, I'm just going to pause the screen at the moment here because these are all the recent stations we have added. All the topics that had been there as SPT and ST, I am going to put in there. So I will pause the screen for a moment. This is already in your study group because this session would be a YouTube session. So in your study group, you're going to get all the recent schedule. Please put in your recordings and put in all the material which is there, which you want to get assessed in, and day and night, the moderators who are MRCPI, they're going to give you the feedbacks And please learn from those feedbacks, because when you are prepared well in the study group, you prepare well with me as well. I want you to present to me when you're well prepared. The reason for that is that I can polish you better. When you're raw and you've not prepared the station, then definitely the room for improvement, which is from my side, that gets a little less because you're on the basis. I want that your flow gets better in the study group. Back to back post your recordings, please. Get your feedback, learn from the feedback. If Anam is posting any recording, everybody should listen to it, because the feedback would be having some reinforcements and some sort of an improvements that have to be done. When it is done, when that thing is done, we have to understand that we are not going to make those mistakes. So learn from each other, learn from the recording and the feedback, learn from the mistakes, and do not repeat those mistakes, please. Right? So Insaf, I've written already for you for the bundle, right? And Farah, I've also written for you for the bundle. Anybody else who is not there? The first circuit we are starting, I just showed the live session, right? When have we had the first live session? We have paid for the Osce reservation. I see, only reservation. That's okay, my dear. That's fine. So you can take the bundle, and that would be including everything. Soumya, 31st. All right, that's great. Soumya, you're an active participant, correct? In your sessions will be already assigned in the participant they're going to present in this time. No, that will be already assigned. You guys will be knowing that, Anam. They're going to post the list today, because now I will be just after this 2 days, then there would only be listeners. Okay, so everybody would be knowing that who is presenting in which. So you don't have a trouble on that. Okay, all right. Any questions so far from the preparation from the course? You all know about the bundle, right? That is all that in one go. Otherwise, it's going to be around 600-700 USD expensive for you. So if you pay in one go, all the three things, they become booked, and you're already there in the group. I think already 10-15 students have done that. So if anybody's still not there, because my mock exams, they get overpacked, and the reservations, they start, like for example, now for even the February reservations, they've started, because they do know that I get short of space in the end always. Can you please post the PDF of the daily cases, the one you showed in the presentation? Soumya, tag Binte Hawa in the Telegram group and tell her to do that. It's already there, but if she's posting one by one, tell her that ma'am is saying that kindly post the PDF, so that everybody can organize themselves and they can take the printouts. All right, Arham says which center needs to be chosen. So the I think she doesn't post all for a reason, that you should do day by day. But if you want to do that as a whole, that's also okay. I can tell her to post the complete. Mohammed, it depends upon your traveling. Mohammed, where are you from? Saudi? Where are you from? It depends upon where you are and where the traveling is easy. So I don't know where traveling is easier. She posted in the group, right, Yasmin? Yes, I told her she posted in the group. Ma'am, some questions which center, I'm still confused. All right, let's discuss the pros and cons of the center. See, the first thing is when it came to UAE, why I told all the Pakistan students to be in Ireland, because there was an ambiguity traveling to Gulf. Now it is in Riyadh. If you guys feel that there would not be traveling difficulty in Saudi, it's okay. You can do that as well. But if you guys ask me that which is more in terms of passing, everybody is different, right? People who are in Saudi, who are in Gulf, they can definitely plan for Riyadh. It's easy. But if somebody wants to appear after that, appearing in exam, wants to shift in Ireland, 2-3 students messaged me. So for them, they want to have a taste of Ireland, they can definitely go to Ireland. But the first thing you have to see is that your traveling ease. That is the most important thing. Second comes, of course, feasibility. Now, in MRCOG 3, we have got a huge difference in different centers in terms of passing and failing. Honestly, in Mrcpi Osce, it's just like very closer. We don't have a big difference between Riyadh and Ireland in terms of success Islam. How are you, Islam? Great to see you, my dear. Absolutely, Farah. Absolutely. Even Farah, India overall is not suitable. Even London, Farah, it's tough. Yeah, it's very, very tough. Right? Thank you very much, my dear. I'm fine. Thank you so much. So the first thing, see your travel ease. And the second thing which you have to see, but please make up your mind today. Don't be confused after this, because if you'll be confused on the center, when would you start studying? So start making up your mind. Make sure, Muhammad, that you know it from today, and then we can plan further. Do not make the idea of preparation later, because it's just going to affect your performance. So whatever are the pros and cons, Insaf, easy in terms of, see, you have to present in Ireland as well. You have to present in Riyadh as well. Nobody's there to fail you. No big difference between, yes, Muhammad, no big difference between the passing and failing too much in Mrcpi, especially when it comes to Riyadh and when it comes to Ireland. But just a little more idea about Ireland, as I say, is there are little more towards guidelines, but in Gulf, generally few of the non-Mrcpi examiners are also there. Few of the students, they often have these complaints that multiple examiners, they're sitting and they are just Arab boards, or they are not even Mrcpi. So certain problems in terms of recommendations or the clinical practice might be there, but it's okay. Overall, all the centers are good. All right, overall, all the centers are good. You just need to be good in your presentation. It's just that what suits you in terms of your traveling. But if you want to have a taste of the Ireland because you want to shift there, definitely I would suggest you to have a trip there. But it's not as difficult as that of UK. The passing is equally high when it comes to Ireland as a center as well. I will be in a better position after 3 weeks' time when the result is announced to even give you more and better idea in the study groups. Then we can discuss the pros and cons after the recent result. And because your applications are going to be later in August, right? So after the current exam, I think we can have a discussion in the study group again about this. What do you guys say? Yeah. So just to do a little, recent exam results, we can discuss about this and we can see that how was the passing, how was the total score, how many were failing. So it gives us a better idea about this. Is that okay? Yes? All right. So I want a candidate here who is going to do one practice station, which is a recent exam station, just to tell you that how the presentation is. So if anybody wants to do a 10-minute station, let's have a taste of the presentation today for the simulated patient task. Oh my God, everybody's like, not me, not me, not me. Anam, Mohammed, Insaf, Islam, anyone. I'm going to be the role player myself. Let's do it, guys. Let's do it, guys. One station with mentor just to get the taste before we start. It's a simulated patient task. We are going to discuss about the recent discussion. Yes, Islam, it is recorded. It's going live on the Facebook as well. Yes, I am live at the moment. All right, who is here for the station? Islam, Mohammed, Hanadi, Insaf, Farah, let's do it. Farah, my love, let's do it. Don't tell me that you guys are not. I know, Soumya, but I'm sure because this is one of the MRCOG recall. So I just thought that the things are going to be very smooth because it is one recall from MRCOG3 that came in Mrcpi. Anybody? Yeah, so I have taught you myself this station. Yes, absolutely, Farah. That's absolutely okay. So I'm going to see you live on 31st, inshallah. Thank you so much. Anyone, please? Anam, let's do the station. Hanadi, come on, don't be shy. Come on. Let's go ahead. I'm listening during the clinic time, can't talk. Nihal, I'm not going to listen to this excuse in the live sessions, yes? Hanadi is going to do that? Amazing. Hanadi, unmute yourself. Yasmin is also ready. Oh my God, just saw Yasmin. Yasmin, can we do that? I know you're all set. Ma'am, circuit is on 31st and I'm active participant. We will be informed before the participation or it will be decided on that day. No, you will be informed about the participation in 2 days' time. Right? Nihal is doing or Yasmin is doing? Or do you want to do 50-50 to support each other? I wish RCPI could take group exams like we used to discuss in MRCPI, yeah?
Yeah, man, we wish.
Nidesh, Yasmin, I can understand. All right, so do I have Hanadi? Hanadi, are you doing, or am I taking Yasmin? Yasmin, you're in Saudi, right?
Yes, ma'am.
Okay, my love. Anybody? Hanadi, where are you? Look at Hanadi, she's not coming up. All right, Yasmin, 10
Ma'am.
minutes. They start now. I will be the role player myself.
Hello, ma'am. I'm Dr. Yasmin, one of the exam candidate today, and this is my sticker number.
All right, thank you very much. Please read your instructions and your patient is here.
Okay, ma'am. I have read the instruction and I'm ready for the speaking.
Start with your patient, please.
Hello, I'm Dr. Yasmin, one of your doctor in the antenatal clinic today. May I confirm your name and age, please?
Hello, hi. Hi, Dr. Lisa. And I am 46 years.
And may I confirm your name, please?
Lisa.
Okay. So, Lisa, it's okay if I call you Lisa?
It's okay.
Okay, Lisa, I have gathered from your notes that you are here today because you had some medical problems and you want to conceive and uh,
Mm-hmm.
and sorry. So, Lisa, I have gathered from your notes that today you are about 33 weeks of around the pregnancy, and you want to discuss about you are planning home birth. So, you want to discuss some concerns. Am I right?
Absolutely, yes. I'm a little concerned about this because I've always been scared of the hospitals and I just wanted to have a home birth.
Okay, so Lisa, it's okay if I ask you some questions and then I can examine you and then we can discuss some investigations so we can come to a mutually agreeable plan so you can have a safe delivery and it's also safer for you. Is that okay for you?
Yeah, sure, sure.
Okay, so Lisa, can you tell me something about more till now about your this pregnancy?
So I'm a little concerned about this. Just want a plan of birth. I get nightmares that I would start having complications, and they would take me to the theater. I really don't want to have an hospital birth. I'm all good. There had not been any problem. I am, I think I'm a happy-go-lucky person, and I'm just scared of being in the hospital. So just wanted to plan my birth with you.
Yes, okay, Lisa, I understand your concerns. That's why I'm here today. So, Lisa, can you tell me when was your last menstrual period? Do you remember?
So that makes me 33 weeks. I think I'm not wrong at my dates.
Okay. And Lisa, can you tell me about the start from your pregnancy? Did you have excessive something, nausea, vomiting? Did you take your folic acid regularly?
No,
Okay. And what about the dating scan? Was it done? Have you booked yourself somewhere?
that was okay.
Okay. And can you tell me that your ultrasound regarding the head to toe to see the structure of the baby, was it done? And how was it?
Nobody told me any problems, so I assume that it's all right.
Okay. And I have gathered from your notes that you are also having the high sugar and the blood pressure. And when was it diagnosed? Can you tell me something more about it?
It's okay. I'm on diet control, and that's not bad. And I don't bother because it just never troubled me. You know, diabetes runs in my family, and blood pressure being 140/90, I don't think it's a big deal. I'm good.
So when was your diabetes diagnosed? In this pregnancy or you are before this pregnancy?
Um, I've always been on diet control, but I think I have it for like 4 years now. But I'm not on any medications, neither I required ever.
Okay, so any test, did your doctor recommend any test to diagnose it around 26 or 28 weeks? by giving you something oral glucose, diagnose it?
No.
No. Okay. So did you ever visit doctor and they suggested you some medicine for the diabetes?
No, they said that it's okay with the diet control and exercise. And one of the doctor did give me some medication, but I don't want to take any medication. I know that any of the medication is not 100% safe in pregnancy. So I just don't want my baby to get harmed.
And what about your blood pressure?
140/90 every time.
Okay, it's every time. And when it was first diagnosed in this pregnancy, or even your blood pressure is high even before this pregnancy?
I feel that I'm 140/90 every time. It's never higher and it's never lower as well.
Okay, so your doctor prescribed some medicine anytime to you?
So they said that I just need to monitor that. And if it gets worsened
Okay.
than this, we're going to start the medication.
So right now you are not taking any medication for the blood pressure or diabetes, am I right?
Yeah.
Okay, I'm keeping a note of it. And Lisa, can you tell me that have you named your baby?
Come again?
Have you named your baby?
So I've got James, I've got Joan, and this is our precious one. Just wanted to have the last baby called Petal.
And how's John moving now?
John is 20 years.
No. Have you named this baby
Petal.
right now? Pardon?
Petal.
Peter. Okay, so how's the Peter moving?
Yeah, she's good.
Okay, and can you tell me that have you ever felt any bleeding, any spotting, and any headache or dizziness?
I'm
Or
good.
have you ever felt that there is any burning, micturition, or there is excessive discharge or itching lower down?
I'm good. Nothing is there.
Okay, is there any complaint of the lower abdominal pain or the gush of the fluid or the bleeding?
No,
No.
doctor, I'm so happy. So contented and everything is good.
Oh, so Lisa, it's good to hear that. I'm keeping a note of it. And what about, may I know that what's about your previous pregnancies?
So the previous pregnancies had been really good and they're grown up and they're so excited to have a little baby now.
Okay, both were vaginal deliveries and there were no complications during
They
time.
both were home birth, so that's why I just planned. It was such a wonderful experience. Yeah.
Oh, that's good to hear. And can you please tell me about that? Was your menstrual period regular before this, before conceiving this pregnancy?
Yeah.
Okay, and are you taking any sort of the medicine? And do you have any allergies from any medicine?
No
And
allergy.
okay, may I know what's your blood group?
A positive.
Okay, I'm keeping a note of it. And can you please tell me that, pardon me asking, that do you smoke or do you take any alcohol or illicit drugs?
I'm not a smoker.
Oh, that's very good. And it's a very healthy routine. And may I know what about your weight to height ratio?
So is it not given to you?
Yes, I have gathered from your notes that it's 42 and I think it's quite high. So have you ever tried to cut down your weight before this pregnancy or?
No, actually, I just got pregnant on this. So I just wanted to take some medications during the pregnancy, but the doctor said that it's not safe. So I thought it's okay, it's fine. So I can't do anything now because I'm already 33.
Okay, so Lisa, as you know, that 42 BMI is quite high, and there are multiple problems that we are having, that high sugar and high blood pressure. So if you say, we can connect you to the dietitian and the weight cutting program, so that we may not gain more weight, and
I'm
we can
okay.
cut down.
I'm okay for that. Even I started saying that to my GP earlier as well, but he said now we can't do anything. We have to wait for the delivery of the baby. So
Okay, so Lisa, coming to your question that so you are thinking that you want home birth. So first of all, let me discuss few things that as currently you are now 33 weeks of the gestation, and according to your history, first of all, I want to examine you with your permission, and then we will carry out certain investigations, and then I will book your appointment with my consultant. So you know that I will like to discuss few things with you.
time is absolutely. 10 minutes at all. Thank you so much. Thank you. All right, thank you so much. A big, big round of applause for Yasmin Javed to coming up. It requires so much of a courage to face the audience when it comes to the first time. And I'm so very proud of Yasmin always to be so interactive in Mrcpi written, also in Mrcpi Osce. Clap, clap, clap. I had invited every single student in the audience, but she was the only one. And let me tell you, this is the first step towards success when you're not having inhibition. Literally, this is the first step of success. We make mistakes.
Ma'am, please, ma'am, one thing.
Yes.
All this credit goes to you who give me courage to come and who give me a chance. Love you, ma'am.
I love you more, sweetheart. And do not face inhibition. Do not feel that what others are going to say for me. Do not be fearful of making mistakes. Nehal, when you guys will make mistakes, only then you will be better. And the mistakes which Yasmin has made today, write it down for me that it will keep on ringing in her ears forever. We are here to learn. I am full of mistakes. Every day I learn. I always tell that nobody is perfect. But when you will be inhibited, oh my God, I can't speak. I can't face anyone. What would others think of me? It is the first step towards your stasis and static growth stops there. You have to grow, and the only way to grow is to make mistakes and learn from this mistake. This is my first lesson for OSCE preparation. Please remove inhibition from your life. This is the first thing I would like to tell you guys. I would like to appreciate the first thing is that 10 minutes speaking is a big thing which she has done. I'm sure that while listening to her, you would understand that ups and downs were there in the station, but because she spoke for 10 minutes, had I been on her place, I would not have been able to continue because it was too much in one station, and that too before starting preparation. I mean, I've not taught anything to you guys, right? I'm going to start. This is just a sample station. So that means her baseline is amazing. And the point of target is absolutely focused. And I appreciate that a lot. So very well done, Yasmin. For me, you were passing. And for me today also, it's a passing station. Very well done for that. Very well done. Now let's come to the points for improvement, friends. Because I've not taught you the OSCE, I do not expect you guys to be 100%. If today you're even at 30 and 40%, I am marking you pass because we have just to start the journey. We are to start the journey. You always have to understand that when it is a circuit station, one SPT we have, it is only 10 minutes station. When I say 10 minutes, then we should be understanding that it is 10 minutes station for the patient where we have to mark the domains of communication with the patient, information gathering, patient safety, and applied clinical knowledge as well. But we don't have 25 minutes. So we have to shrink the history. We can't expand the history like that of a long case because we have only 10 minutes. In 10 minutes, we have to complete the applied clinical knowledge as well. Let's start from the beginning. When we started the station, I told you guys that you are going to greet, which beautifully Yasmin did. I'm Dr. Yasmin. I'm one of the exam candidates. This is my sticker. So you're going to give that because you're going to have a complete sticker sheet and you're going to peel off one sticker. The examiner is going to put it on your scorecard. That was beautifully done. Then would be your reading time. She read it, but she missed the situational awareness. We missed the situational awareness saying probably it is a preconceptional care, but then she realized, no, she's pregnant, and she shook her head. So my first learning point for all of you is take a good amount of 30 seconds, but please understand the situation. Because if you don't understand the situation, you start with a lack of confidence and you might make a mistake. Are you guys with me? Yes. So the first learning point is that when you have a station in front of you, Nihal, Farah, Sadiqa, my dear, Mohammed, Anam, please read it for a complete 30 seconds and understand who you are, where you are, what is the agenda. And then you have to start asking the questions. The first question has to be an open question. So if I would have been at Yasmin's place, I would have said, how can I help you today? May I know the concerns behind this visit? So immediately my things could have been, in long case, yes, Farah, in simulated patient task not needed. It's just 10 minutes. In long case, I tell you to write the points and I mark your points as well on the page. How do you have to write it? So why I always like open question? Because it makes your life easy. The role player, all of you, has got some instructions in front of her. And in the morning before the exam starts, those instructions are given to the role player. Please give her a chance to make your direction of the station. If you start asking about the history randomly, you might lose the agenda. Agenda here was that she wants a home birth. So if you would have asked an open question in the beginning, rather than asking an LMP, I would not ask the LMP because I've been given sheet 33 weeks. It doesn't make any difference. HOPI was missing. When we asked here the bleeding, the spotting, this was HOPI, which we asked when 2.22 minutes were remaining in the clock. That means that you had already done 8 minutes of the station and you were asking HOPI. HOPI is now at 33 weeks, bleeding, spotting, any complaints. This is the current pregnancy, right, Yasmin? We came to it so late. I was expecting it here at this point. These questions should have been here. I will do it for you guys. You asked about the ultrasound. You asked about the dating scan. I appreciate that, but she's 46 years. Shouldn't down screening be part of it? This was a patient safety, that she's been screened for Down. So note, she's 46 years. It's not must in Ireland for everybody, but a patient who is high risk, we do the Down screening, right? I would not speak about the glucose OGTT because it's written type 2 diabetes. That means that again, we missed the situational awareness. First, we missed the situational awareness when she was pregnant. Secondly, when she's already diabetic and I'm doing OGTT, again, the examiner would feel that something's wrong. Either she doesn't know the applied clinical knowledge or she has not read. Both the cases, we are losing the scope. Then I could feel that we were extending the history so much because at this time, 6 minutes were already done. I cannot give you more than 3 minutes in history for a patient in SPT. In 10 minutes SPT, please write down everybody. I cannot give you more than 3 minutes because it's a lot of discussion and 10 minutes I have to complete the station. So we were dragging the history. How? As we do in the long case. We take very long history. 7 minutes we take in the long case history. But here, 3 minutes because we've got other content to cover as well. Right? Asking about the baby movements, asking about name. Again, I had 2 kids, 20 years and 18 years. I named them, but my first 20 years kid name was understood as the current one, which I said was Petal. So again, there was a little misunderstanding, or maybe the understanding was not fine. You can always ask the role player again. So may I confirm that you have named her Petal? How is she moving? Is everything okay? This again is HOPI, not here. This all is your 33 weeks present complaint questions, Yasmin. The baby movements, it came very late. It came at 6 minutes. After that, you asked the OBS history. You asked about the periods regularity that was not needed. Why? Because she's already 33 and it was conceived through egg donation. So do you expect periods to be fine? It was a test tube baby. The biggest question which I would ask here is that after having 2 kids, what was the concern behind this? Isn't it important, guys? At 46 years, when anybody has got 2 kids, the concern of a plan of having a 3rd pregnancy is definitely is something to be asked. I mean, maybe there's a breakup of a relationship. Maybe there's some social stress. Maybe she needs support. This point was missed in the history because anybody who has 2 grown-up kids at 20 and 18 years, both are adults, and now she plans an egg donation in IVF pregnancy, some social circumstances seem to play their role. Yes or no? Do you guys agree? It seems to be a little, some sort of a reason should have been there. So social support is needed in this case after asking. Now, in SPT, please write it down. I am very strict in deducting the score if you guys do not read the station and bring up that information asking again from the role play. For example, save your time. BMI 42 is given, right? So you asked me that, may I know your weight to hydration BMI? That means that we are again not reading the station carefully. I was very, very happy with your blood group. I was very, very happy with asking allergy. That was beautiful points. Connecting to the dietitian was amazing. That was really nice. But because we expanded the history so much that we couldn't discuss about the home birth here. Right? So if 3 minutes history should have been short, we would have completed the station. Again, there were so many good points in the case because it was a first ever case. And I've not taught this case, honestly. It was just Yasmin's baseline, which is much, much better for me. It was, again, a very passing approach. And I'm super proud of this presentation, Yasmin. I'm so happy. The way you have done is just your baseline without mentor's input. So I'm very happy with your starting point. Very well done. It is a recent exam station, Farah. Just the recent exam station, my dear. Now I'm going to do this station and you guys would see that how the presentation should be. I'm going to do the presentation just to keep you guys on track and see that what should be the focused history like. I will start the timer as well and will make you guys learn, and then I'm going to show the slides as well so that we don't go above the time as well. Hello, I'm Dr. Yasmin. I'm one of the exam candidates for today, and this is my sticker. So now I'm taking my 30 seconds to read, okay? I always see the domains first. What are the domains I'm tested for? The age. I'm ready for the case, please. Thank you. Hello, I'm Dr. Yasmin. I'm one of the doctors in the clinic today. May I confirm your name and age? Is it okay? I call you Lisa. Thank you very much, Lisa. So you're 46 years and you're here today in your third pregnancy. Am I right? All right. With regards to your pregnancy, I have certain questions in your own words. If you could tell me the details about your concerns today, I'm here and happy to help. Thank you. All right. Okay. I do understand that. Undoubtedly, home birth is a wonderful choice, and we do appreciate and support being in the comfortable environment. We are here to support you in your decision, but before that, would like to gather some more information so that we can come to a mutually agreeable plan. Is that okay? Thank you very much. So you are 33 weeks in your third pregnancy. I've gathered some information that it was a test tube baby with a donation. Is that right? Can you please expand on this and tell me more the concerns behind that? All right. I'm sorry to hear about your tough circumstances in the relationship. So do you feel well supported at the moment? All right. Okay. And going back to your previous kids, were they normal birth? Any complications in that pregnancy? All right. And are they well supported as well? That's fine. I do understand. So you're happy with this pregnancy? Any complaints at all? Any bleeding? Any pain? How about movements? Did you name your baby? Is it a girl or a boy? She's a girl. That's lovely. All right. And she's okay in terms of movements? Yeah. I appreciate that. Okay, that's great. So with regards to your medical condition, I've been provided with certain information regarding raised sugar levels and blood pressure. I had a little concern because you're not on medications. Am I right? Yeah. So any sort of treatment that has been suggested and you're not taking, or are you okay with your blood pressure and is it controlled sugar levels? I see. I do understand your concerns that you don't want to take medications. However, it can have certain implications. So with your permission, we can get you connected to the sugar doctor and the blood pressure doctor, if that's okay for you. Thank you very much for accepting that. And we need your cooperation in this regard. All right. So, so far, all the ultrasounds, they have been fine. The blood reports that had been okay. Yes. So 33 weeks in your dating scan was the same. And because of certain risk factors, were you offered the Down syndrome screening? That was normal? That's reassuring. All right. With your permission, I'm going to see the reports as well. Is that okay? Yeah, that's fine. Your weight to height ratio have been 42. That's been informed to me. So any concerns regarding having the pregnancy with this, or did you try to reduce the weight? All right, I'm going to get you connected to the dietitian exercise specialist if that's fine. Yeah? All right. Any other medical concerns at all? Any problem in the previous pregnancies at all? Any surgeries on the tummy or down below? No. Do you smoke or drink alcohol? I do appreciate that's really good. And any known allergies? No. What do you do to live? Do you work? All right. Okay. Any family history of concern? Nothing like that. That's fine. Okay. So coming to your concern, thank you very much for all this information. Anything important you would like to tell me? All right. Okay. So, Lisa, I would like to confirm that did you have any sort of a concern regarding the hospital birth, or if I may ask that, why do you want to choose the home birth? Mm-hmm. Okay. So may I know the reason that what makes you scared? All right. Okay. I'm sorry to hear about difficult circumstances for your friend, but I do have certain concerns with your pregnancy and certain concerns for the safety as well. Can I discuss those with you? So at the very outset, I would like to tell you that every single patient, she has a choice if she wants to deliver at home or she wants to deliver at the hospital. And when she wants to deliver, how she wants to deliver, we as a team of doctors are here to support. I really appreciate that home birth is a wonderful choice. When it comes to home birth, away from the buzz of machines, being in a comfortable environment, being with your loved ones, that is something which we strongly suggest, but generally in the low risk patients. When I say low risk, it is that the factors which can complicate the pregnancy, that should not be there because we need some helping hands to support the pregnancy and to avoid the complications to happen. Are you with me? When I say the benefits, there are a lot, but when I see the risk factors in your condition, there can be chances of having instrumental birth because of increased BMI. There can be chances of having cesarean section, failure to progress in labor, and more chances of bleeding after the birth of the baby as well. Are you with me? With regards to the age, the chances of having the operative vaginal delivery or cesarean section are higher. And with regards to the condition, diabetes and hypertension, we have to control them judiciously because there can be a risk of having proteins in the urine, there can be a risk of having seizures and fits, and there can be the risk of having complications, unfortunately, death of the baby inside the womb or after the birth of the baby as well. I'm sorry, I'm coming up with lots of information. I don't mean to scare you, but I have to be open and honest because when we know that these are the anticipated complications, we take certain steps and measures to prevent them to happen. Are you following me, Lisa? It is going to be a team of doctors care plan. From 33 weeks onwards, we would like to see you after consultation with the dietitian, blood pressure doctor, and the sugar doctor. We expect everything to be fine with the team of doctors liaison and coordination. But if any complication arises, we might require admission for you as well. Is that okay? I would be happy to offer you all the plans. Again, the pros and cons and the advantages and disadvantages. The choice definitely is yours. But with regards to home birth, we expect complications or we expect support to be more because we need baby doctor, we need anesthesia doctor, we need operation theater, all to be besides, and it's going to be my consultant supervised labor plan. Are you following me? So you can discuss with your partner. We are not in a hurry, but we are going to take it step by step. I want you to come up with a discussion. I can counsel you as a couple, but if anything we can do on our side, I'm happy to do that. I can take you through the labor suite and you can have a quick tour that how ladies they are in labor, how they are supported, so that you can make up your mind. If you want some sort of an adjustment like listening to music, having your partner around, having some candles. We can make it as closer, as comfortable to your home, but having support from the team that is suggested in your case. Please think about it and let us know whatever you will decide. We are happy to support. but we expect a very healthy pregnancy outcome for you, and we are here to support as a team of doctors. Anything else I can help you with? I will give you the patient information leaflet. I will connect you to certain support groups as well. I will make you see and talk to certain group of women who have been through your condition so that you can make your decision. And I'm happy to see you as a couple in the next appointment. Is that okay? Yeah. My consultant will be here to talk to you as well. If anything we can help with, this is 24/7 hospital contact number. We expect you to take care and be watchful for the baby movements. And if anything unusual like pain or bleeding or the movements are less, please see us without any delay. Thank you very much for talking to me today. We will be waiting for your decision. These are the information leaflets. And thank you very much for seeing me today. Right? This is the whole consultation I want with a very, very safe attire. And let's see the timer. It is 9 minutes done. So I expect that, of course, the patient would also be speaking a little. So it will be 10 minutes then, because, you know, we see certain concerns and we have to talk about this. Did you guys understand how we have to complete this? Right? Okay. So it depends upon that what was the age of the donor, Farah, because we are not sure of this information. We can definitely speak about this. Paternal age also matters, my dear. Right? Okay. Did you guys understand the sequence? Did you guys understand the empathy? And don't expand the history so much. Right? Don't expand the history so much. So she is 33, Anam. So we assume that she would be on this. We will not start at 33, right? This should have been started at 12 weeks, correct? Everybody clear? So give the pros and cons. Let's go and revise the slides once again. It's always important in the negotiating station that you go ahead with HOPI first. The problem which we faced was no need, Sana. We don't do that. Pregnancy details of the current complication. Now the time is up. Current complication has to be, or current complaints have to be asked. So we learned, Yasmin, that we did it later. Did you see that? We did it later, right? 6th minute. 33 weeks, baby movements, everything is okay on the ultrasound. This is your HOPI, my love. And then this part we didn't discuss at all. This all was HOPI. This all was initial part. The first 2-3 questions like I did. Okay? Why breaking bad news, my dear? Home birth negotiating station. It's not a breaking bad news station. Touching the BMI point, be very, very sensitive on that. If she gets, you know, angry on this, take all the surgical, medical, family support, drug history, allergy, everything by herself in terms of sequence, right? And you should be knowing about the smoking and alcohol. I think we missed that, Yasmin, right? We didn't ask about the smoking and alcohol. We did ask about that? So we are going to, yes, we are going to know about this. Might be few of the patients might be smokers, so we can connect them to the cessation programs. Give the pros and cons. I do not want any of my student in the negotiating station. You know, there's a station in RCOG where she has previous 3 scars and she wants a VBAC, which is not permissible. So still appreciate VBAC. Whatever patient wants, please 1 to 2 points in appreciating that, do it. This is a way of negotiating. And then come to the concerns. We say, yes, it's a wonderful choice. Away from the buzz of machines, less chances of intervention, comfortable environment with your family members, familiar environment. But in your case, we have concerns. Got it? Always a negotiating station. Do the first part is always appreciating. You know why? Because it increases the absorption of the listening to the points which are against. Otherwise, it becomes very difficult to convince somebody by saying, no, home birth is not good. No. This is not a negotiating way. Negotiating way is always appreciate first. And when you appreciate first, you're always in a strong position to convince the next person. Some good points are always there. There's another recall station, guys, which is she's 30 years and she wants sterilization as a choice. And you say, no, sterilization is not a good choice. You have IUCD, you have IUS, you have DMPA. This is again a wrong way. You say, undoubtedly, sterilization is the best way, one of the safest way, and the chances of having the failure are pretty less. I do appreciate. However, In your case, we suggest certain options which are reversible as well because of the age being lesser. Do you guys get it? This is how you negotiate. One negotiating station as a simulated patient task. She's insisting for something else. You want something else. Is very commonly asked because it is a communication challenge, right? Patient wants something which is not suggested, which is not evidence-based. So you should know the way of negotiating station where she's asking something which is harmful for her, but you cannot negate her outrightly. You have to convince her with your advantages and disadvantages. Am I clear? Anam, Sana? So examination in SPT generally we don't do. If you want to do that, just it's like I would like to examine you in the presence of a chaperone, but we don't explain the examination. We don't go ahead with the examination in terms of explaining. Clear? This was just a glimpse of one communication station. We learn a lot. Very well done. I'm so grateful, Yasmin, and I'm glad and excited to see you guys in the Osce when at least it would be an interactive one. In part 2 written, you guys just used to listen to me. So I'm happy that I'll be listening to you guys and we're going to enjoy the communication and preparation of Osce together. Thank you so much. Any questions, please? Thank you very much, Yasmin. I'm so grateful for coming up with the station. Any questions regarding preparation, regarding curriculum, regarding active listener Osce, regarding fast track, regarding mock exam, regarding the paper study pattern, anything is there, please. I'm happy to take the questions. Yes, please.
Yes, ma'am. I want to ask a question. Ma'am, as we applied in the May Osce, so we were refused at seat were not given. So, ma'am, are we in the queue? And what are chances that inshallah we will get seat this time? And what are the chances that we may again be denied?
So the chances of getting seat are definitely higher. The ones who are taking the September exam, Yasmin, I had their session of Eurogynae 3 days back. So they all are ready for November. They were saying, ma'am, September we'll exam and we'll apply. So I was telling them that definitely the March people are on priority. So you can understand that those applications, when they'll go, same as that for May, you guys were there when you passed in March, right? So I do expect that you guys are definitely preferred in terms of the sequence, but 100% definitely we don't have a surety, but preference would definitely be there.
So, ma'am, inshallah, we will have high hopes that we can get.
Absolutely high hopes. Yes.
Okay, inshallah.
Thank you. I have
Yes,
one question.
Yes, my. Alaikum assalam. So good to see. Yeah.
Ma'am, I just want to ask that this station that you just did, how do we know that this is only a negotiation station and we don't have to discuss the entire birth management, diabetic?
So in each station, yes, in each station, when we have the station, on the bottom of it, your tasks are written. So the task given was that please discuss the birth plan, address her concerns for whom. So and in the start of the station, when I told Yasmin that I will ask her concerns, she says, I'm here today because I want to discuss about my home birth plan. So agenda is very clear. Not about any
agenda will be clear.
Very clear.
Okay, that's what I'm
They
confused.
can't give you all the details from the 33 weeks of pregnancy and going ahead. So they know the agenda.
And one more question, ma'am, regarding the portals. As I was asking about the old recordings, so there will be sample recordings that we can hear and prepare ourselves. Are there any?
So Farah, because I'm updating, because of the recent stations, so audios daily now Bintava is going to put the one of the station there and you're going to put the recording of that. So you'll get a feedback. So in 1 week, between that, you will prepare all those topics, everything, and the template is already there. So all the templates are already there. Yeah, all the ebook we have where the templates are there, you're going to extract the information. Most of the stations I make in a way that you guys can do both the SPT and ST from that information, because like sickle cell disease, it is a structured discussion, it's a simulated patient task. So we are coming up in both ways. So we should be able to manage it both ways. So similarly, the ebook is sufficient and the content in the templates are sufficient, my dear. It's just like how we are going to practice.
And also, ma'am, like you said, we have regular 8 sessions, right? So every active student will be able to participate those days.
I'm going to give
Any
the
of
list just in a bit. Yeah, yeah. I am
sure.
going to take you guys all, no matter we are going to do multiple recalls there. But just in a
Yes.
bit, I'm going to the study group. The team is going to approve the list from me. Okay.
I'll make the payment today, ma'am. Thank you.
Yeah,
Thank you
sure.
for the bundle.
On the bundle, I'll just add you there. I hope team has given you the link. Yeah. You have
Yes,
it, right?
ma'am. I will see. Thank you.
Okay,
I
my
will
love.
have. I will see. Okay.
Sure,
Thank you.
my
Thank you.
sure. Take care. Take care. See you in the study group. All right. Anybody else? Any question? Happy to start with an introduction. When I was taking the May batch daily, Anam used to message, ma'am, when are we starting? Ma'am, when are we starting? I said, once we'll start, then I'm not going to leave you guys. Then it will be so strictness. So breathe for a few days so that we start preparation. Yes? Sadiqa? Yasmin, all happy? Anam is so happy on starting. Anam, now please start studying as well. Hiba, can we make tasks module wise? We can make it module wise, but every module is not touched. Actually, Hiba, in MRCP 3, the circuit is like maternal medicine, antenatal care, early pregnancy, gynecology, fertility, urogynac. But Hiba, here in MRCP Osce, they are not module wise. They are like one procedure comes, one obstetric emergency comes, two from maternal medicine comes, obstetric comes, two from gynae comes, So pattern is different. That's why we can't make everything module wise, because no matter you do one module, you're not able to do that. Yes? Yes, Insaf. The questions, I mean, what I'm going to cover in the first topic, yes, she's going to post that. Bindu
Hi,
is going.
Dr. Sidra. How are you?
Hello, so good to hear you. How are you,
Yeah,
Insaf?
I'm fine. Okay, I'm fine. Missing you so much.
Thank you, Mr.
I'm just have a little query about the way of studying. So when I'm going to make uh, any long case or short case, I mean, should I have to study the subject first before I'm starting to make like scenario of long case? You understand what I mean?
I do understand.
Do I have to collect all the information about this case before I'm starting to make this prova that we're making with the moderators in on the regular group? You
All
understand
right.
what I mean?
I do understand. All right. So the first thing that you guys have to understand is that circuit out of those circuits, the 6 stations is going to be all together from the recommendations. It is going to be guidelines, Irish guidelines, right? So when you're preparing for any topic as a circuit, you should be able to do all the recommendations because the questions are going to be from the recommendations. This is for the structured discussion in SAF. So when you pick up one topic, that guideline revision from your part 2 written notes or from the recommendations of the guideline should be known to you. Your ST will get prepared. But the same topic when you're doing as an SPT, for example, we are getting an example of sickle cell disease. When it is SPT, then in that case, you should be knowing about having the simulated patient task. In that case, you should be knowing that for SPT, you should read the patient information leaflet. Because the same recommendations which you read in the guideline, you should be able to speak and counsel the patient. All right, that is so important. So read the patient information leaflet and then your station gets prepared. Ruhi, I will tell them to post the
Leaflet is
topic.
available in our portal, right?
Absolutely. Now, if you open up the ebook, Farah, you will have topics index. You see sickle cell disease, you will get the complete 10 pages. That is sufficient for the structured discussion, that is sufficient for SPT. We cover it in a way that the topic gets completed. Every single topic which you are doing in the study group, the scenario is there. Ruhi, they can put the scenarios, not a problem, my love. I will tell them. But scenarios might be changed in exam. The topic would be the similar, right? The age and these things, they might be, topic would be similar. They would say that, oh yes, sickle cell disease theme, right? But I will tell them to put the topics as well. I'm noting down. Okay, my love,
Ma'am,
Ruhi.
just
I'll tell them to put a complete scenario. Yes, my dear, sorry.
then like today, if I pay and they will add me to the group, right?
Yes.
And so I will post my recordings, whatever.
Yes.
So will they give me feedback because I have made the
Exactly,
previous
yes.
one? No
Daily,
problem.
daily, everybody is getting the feedback. Everybody has to listen to others' recording and their feedback as well so that you don't repeat that mistake and start speaking from today. Active participants on. Listeners, they don't get the feedback. Active participants, they get the feedback. Okay? Sure. Any other question? Sure, Ruhi, I've written it down that it has to be scenarios. All right. Any other question? Any other question? Am I clear about the curriculum? Am I clear about the paper pattern? Am I clear about the applications in August? Am I clear about the venues of exam? Am I clear about the paper pattern? Am I clear about the preparation technique? Am I clear about the presentation technique? Am I clear about the
Doctor,
fast track and the mock
um,
exam?
excuse
Will
me,
we
doctor.
this video? Yes, Farah, I'm going live on Facebook at the moment. It will be on YouTube as well. It's an introduction session. It's an open session. Yes, my love. The YouTube, it will be uploaded on the YouTube as well.
Excuse me, doctor. Can I ask something,
Hello, it's
please?
love. Yes, my love. Please.
So I'm going about the ebooks. Is it sufficient to read all the information about every subject, or I have to back to my
Have
subject in
only 2025 2-3 guidelines updated in March. They are not in the ebook, which I'm updating. So that will be updated in around, I think, 1.5, 2 months. Rest, everything is sufficient. Only 3 guidelines are not there. Those topics I have to add. That's it.
the ebook, everything. Okay, thank you so much.
Thank you very much. Hello, Sidra. How are you? Good to see you.
Alhamdulillah, ma'am. Fine.
So good to see you, my love.
Yeah.
I know now planning for
Ma'am, I
10.
wanna ask. Yeah, ma'am. In fact, I got the seat in for my, but
I
due to
know,
Mrcpi seat, I told you. So
I
what
know, I
should
remember.
I don't know what to do now.
It's okay, no problem.
So
Allah
is
will
there any
help.
chance that they will give me the chance again or not?
No, they definitely will give. You can write it down and you can write, make an email, get it checked by me.
Mm,
That should also add on the point of that recent thing which you are facing for MRCOG, okay? Why? Because that
yeah.
would add compassion, okay? Draft an email and get it checked by me, and then I'll tell you how to post that so that it actually gives your exact situation idea. It would help you. Because
Yeah.
nobody
Okay.
knows that,
Okay.
we shifted this for MRCOG, but we are not able to take that as well.
Yeah.
Let's put that in a complete situation so that the college understands your situation. So they should be
Yeah.
at least we should give the right picture so that they're considerate. Okay.
Yeah. Sure.
I
I
know
will.
what you guys
Thank you.
need, Farah, what timings do you guys want? I'm happy to do that. You can write in the study group. Please tell me. What timing suits you guys? Morning? Look at Anam. You guys in the written exam used to do the same.
Ma'am,
Anna?
please morning, ma'am. Please, please, please. Zakaria will be in
I'm okay.
school or daycare.
So 6 a.m. GMT you guys want, is it? Yasmin?
Yes, yes, that will be okay.
Ma'am, actually, I want to request that we will have a duty timing, and this session are totally interactive. It's not like the written
Absolutely.
that we
Absolutely. And
can
no, even if
that
you're
we
not
can
presenting
listen
case,
the
I want you to.
recording.
So what we can do is that please let's do a poll. Anna, write in the Telegram group for all the students. So if we would have all consensus, then we can do morning. If we don't have consensus, we can do one morning, one evening, one morning, one evening. Okay, so everybody is happy.
Yes,
This is
ma'am.
okay.
And what about my MRCOG 3 timings what you are having? Same
So
like this
Farah, that
morning?
too in the study group I take. Morning is always one batch, yes. So I can put you in that. You can attend that
Hi,
batch.
mom.
Okay. Okay.
Hello, Islam. How are you?
I'm fine, mom.
How
Thank
is
you.
Galal? He's
Yeah,
good?
it's good. Yes.
Oh, that's good to know. Yes,
Mom,
my
is five months it is enough for preparation to give this exam?
for you, it's
Yes.
okay. I know Galal will make you study like anything. I know that he will be very strict with you. 5 months are okay for you, Islam. It's
So
fine.
for me, I can choose Ireland to give exams or Saudi
You'll
Arabia.
go to Ireland. No, you'll go to Ireland, yes.
Okay, thank you so
Okay,
much.
and I told him about the mock exam as well earlier when he messaged me. So come to the Ireland mock exam. It will be 3-4 days before the exam, okay?
Thank you so
Ma'am,
much.
can I ask one
Your
question?
first OSCE Islam, so please start studying now because you have not taken any OSCE earlier, and MRCOG would be next year because after you complete your 4 years. So start studying now, my love. Okay?
Okay, thank you, mom.
Dear, thank you very much. Can we know the task we'll do in the next session to be prepared better? Hiba, yes. Please message in the group now. I've told Binte Hava. Okay, I've told her one thing. I'm going to do the circuit station 7, right? In the first session. But I've told her not to give 7. I've told her to give 10. So then at least something should be like, you should not be counting, okay, this is done. Often we do the last. So 10 is okay. 10 is okay, guys. Hiba, 10 stations. Out of those 10, I'll do 7. So 3 would be of circuit 2. Is that okay? At least you know, a little ahead should be there. So you have a pressure. Yes, Sidra, my love. Morning and evening both is better option. Very good. Ruhi is the best student ever. She's saying anything is better. Ruhi, what we'll do is
Yeah.
that one morning, one evening, okay? So that everybody is like compensated. One circuit I'll take 6 a.m., whatever you guys say, and one we can take 2 p.m. So everybody is happy and at least they are not pressurized for the time. Absolutely.
Yeah.
Practice is so much, and I'm going to be strict on practice. I will write down the lines in front of you guys. You will write on your notes and then you'll put those recordings in the group. Just speak more so the fluency is like, you know, a water flow. I really want that when you're speaking, it's just like water flowing. This is what I need from you guys. Yes, Sidra, my love.
Yes. Ma'am, I want to ask about like, should we take the preparation for both exams side by side if they don't take our exam in for that
No,
cancelled
you,
exam?
yes, because I've coached you for part 3 so I would say accurately. So for you, just prepare for both because see, unforeseen like this situation, we don't know, my love. So
Yeah,
many
obviously.
students. I'll tell you, my Chennai students, my students, they've taken 3 OSCEs together, Mrcpi, EPCOC, and MRCT3. You can take both
Yeah.
of. And now this time, Sidra, we have a gap a lot as well. This is 30,
Yeah, obviously.
and then we have 15 days gap between MRCT3 in November. So
So I should.
let's wait for 1 week. I think college is going to announce for you guys, right? The delay in the exam. So that would
Yes,
make.
ma'am.
Meanwhile, do not skip your MRCP OSCE. Make your mind for that.
Yeah. Yeah.
Okay.
I was thinking in the May, but I don't know what's got into my mind that I didn't fill the form. I
It's
don't
okay.
know.
No problem.
Anyways.
No problem. We just
Yeah,
manage.
yeah. Okay.
If they come up in life, it's just that we have to
Yeah.
fight back. Yes.
Yes,
So
ma'am. Sure. Yeah, always. Thank you so much.
thank you so much. Thank
Yeah, thank you.
Sure, Hina. So the next session is what date, guys, so that we can fix the time. Farah, what is the date for the next one? No, no, no,
31st
no.
May, ma'am.
Good. When is Eid, guys? Is it 7?
5, 6 June, 5th or 6th of June, I think.
Don't tell me. How 5th of June? My calendar says 7. Okay, hold on. So we are having the session on 31st, Saturday.
Yes, ma'am, 31st May, and then I think 10th June, 14th June.
So 31st May, when do you guys want?
31st May, 14 June, 26 June, ma'am, anytime. But after that,
31st,
one,
31st Saturday, you guys want evening or morning? Fix the time so that I can just write in the schedule accordingly. Early morning, you guys want? You can write in the group and evening. All right,
Ma'am,
write in the
Saturday makes no difference. Saturday babies will be home. So
Yeah,
anytime it will be
yeah.
difficult.
Okay, so the working days you want morning, right?
Yes, ma'am. Working days morning, yes, definitely.
Okay,
Because there
okay.
will be a school.
All right. Hina, please write down the timing so that we can make a poll and then I announce by evening so that you guys are ready. So Saturday is the circuit station number 1. Please, I'm going to do 7 stations with you guys. Make sure that you guys are ready for this. And then after that, we are meeting on 14th. That also is Saturday, correct? 31st and then 14th. Yasmin, am I right?
yes, ma'am, 14th, and then I think 26th June.
Yeah, so basically 26th June is going to be a working day. We can do that in the morning. All right, no problem at all. So whatever you want, I'm going to just plan it and I'll announce that in group for the Saturday. Make sure that you guys are available. I'll just make the active participant tell the team to put it on the group so that you guys are all ready for that. Thank you so much.
Ma'am,
Thank you.
for
I
any
will
day,
not tell
ma'am, for any day,
Yes, Farah.
if because of any circumstances, if I request to put me first or second on the list, will that be
Absolutely.
possible?
Absolutely. You have to present your case. You tell me that, ma'am, I'm available
Yes,
only
ma'am.
in 10 minutes. Do the first one, do the last one, do the middle one, but plus just do your presentation and then later you can listen to the recording. But at least do
Okay,
your
ma'am. Then it will be. Yes, ma'am. This time I will, inshallah.
Absolutely. Anytime, do 10 minutes presentation. Either you're on duty, take 10 minutes from the tea break and present to me. Even listen to the feedback in the recording, but please present to me. Okay? All right. Thank you very much for a lovely introduction. Again, it never seems that it's a session or a talk. It always seems to be a family gathering and connectivity. Thank you so much, Insaf. Thank you, Anam. Thank you, Hina. Please work hard from today because November seems to be far, few months, but there would be just with a blink of an eye, time would be done. And I don't want that last moment pressure. Hina, what I want, Nehal, what I want is that we practice it so much that even when we are sleeping, we are walking, we are eating, the lines and the flow and the topic reinforced is on our fingertips. I would work hard with you guys. The moderator would be there 24/7. At the end of the day, do not aim to pass this exam. Aim to score 80, 90%, and you would see that how high the scores would be, and you would feel proud of yourself. Make your family members proud, make your mentor proud. You all are capable of this. I will give you everything in one direction, in a platter, but I just need your support, cooperation, consistency, and faith in yourself. Rest, leave everything on me, but please give me your best. You would see the change in your presentations, the change in your approach, and the happiness and the contentment. No tears, no stress, no anxiety, working hard to prove yourself to be the best. Thank you so much. I love you all. Take very good care of yourself. Best of luck from the entire team of RFA tutors. Take care. Bye-bye from your mentor. See you guys in the study group. Bye-bye. Take very good care of Yamanal, everybody. Thank you so much. Thank you.